Hi, everyone, and welcome to this webinar. Good morning, good afternoon, depending on where you are in the world. I must say I am extremely pleased to be here for this webinar. As we were doing the research on this, we found that there were very few conversations between the media and women's, children's, and adolescent health experts. So we're extremely pleased to have this conversation happen today, and I look forward to learning as much from our speakers as to the participants in the room. But perhaps let me introduce myself. My name is Kadi Touré. I head communications and campaigns at the Partnership for Maternal, Newborn, and Child Health, which is the single largest global alliance working on these issues related to sexual, reproductive, maternal, newborn, child, and adolescent health. We bring together approximately 1,500 members across 131 countries in joint efforts to really improve policies, financing, and then the implementation of programs for women's, children's, and adolescent health, working through accountability. And we will touch on this later. Adelaide specifically will provide some of the backgrounds on the issue. But as we know, every year we lose 260,000 women to preventable causes associated with pregnancy and childbirth. And we also lose 4.8 million children under the age of 5 from preventable causes. And while there has been progress, we've seen dramatic cuts since the year 2000. That progress has been too slow. It has been inequitable. And for the past 10 years, since 2015, we've actually seen a slowdown in that progress. Currently, where we stand, we face challenges linked to climate change, to conflicts, and current geopolitical shifts, which are affecting financing, for one, as well as the backing for human rights or the anti-rights advocacy for these, for making these the progress around these issues even harder. We know that not enough is happening. We know that most people would tend to agree that women, children shouldn't die from these preventable causes. But I think what we're here to discuss today is how we can make this issue sufficiently visible for it to no longer be accepted as an unfortunate normal, right? Media is one of the most influential forces in shaping public perception, public attitudes towards health, as well as how policymakers respond to them. We know that there have been some commitments towards women's, children's, and adolescent health. What we see is a lack of implementation of those commitments. So when it comes down to finalizing, attributing budgets, and making sure that the plans are implemented, there's always a difficulty there. And media plays an important role in prioritizing these issues, both for policymakers and for populations. But we know from conversations with the media that they face a number of issues in reporting on these questions, some related to lack of access to data, lack of access to the human stories that make this interesting. Also, challenging environment, right? Competition in increasingly decreasing spaces online with issues that are deemed to be more priority, deemed to be a bit more sensational. So the conversation that we want to have today is, how do we enable and support media to be able to report on these issues more systematically? So where are the data points? Where are the data sources that media need to reach out to get the information that they need? Who are the people that they need to talk to get some of these human stories? The first panel that we'll have will be between journalists to really hear from them what have been their experiences in reporting on these issues. What are the tools, strategies that they can use to write stories that capture, that captivate, that relate, that people can relate to. And then we'll also have a second panel to think about what sort of enabling environment can we create for journalists, the media, editors to report on these issues. So what are some models of partnerships that have been put in place that can help facilitate these questions? So we're really trying to frame this as a conversation, a learning space for all of us to reflect on these issues and to inform the work that we do moving forward. So without further ado, ado, I will hand over to Nonkululeko, who is a global health advocate, but also a board member of the International Stillbirths Alliance, to formally open this meeting for us and provide some welcoming remarks.
Hello, everyone. Greetings. Can you hear me clearly?
Yes.
Yes. My name is Nonkululeko. I am a board member of the International Stillbirth Alliance based in South Africa. I am a parent voice advocate, and I'm also a bereaved mom to a stillborn baby that was born 15 years ago. So Kadi spoke in broad stroke about the health issues that women and newborn faced and the important role that you play. So behind the numbers, she also raised an individual's stories. For me, basically, it started when I was 18 and I woke up in the middle of the night and baby was not moving. Back then, at that time, I didn't know that babies could die in utero. I didn't know there was such a thing until it happened to me. And it was the silence, the loudest silence in the room, because the communication was not there between myself and the healthcare providers. It was not proper. I was just taken from one room to the next, and there was just checkup after checkup, and they kept communicating amongst themselves, and nobody said a word to me until I was taken to a final room where doctor confirmed that baby is no more, and I was alone. He didn't bother to ask if there was someone in the room with me, or there was someone accompanying me. And so it was just me, and he broke the news, and I was then admitted. So with that, there was a whole lot that I could say went wrong that I wish I could change, but didn't have the power to change at that time, looking back. And which is why I'm doing what I'm doing, which is advocacy and having changes, especially in communication between healthcare providers, community leaders, and parents as well, in terms of what happens when a mom has lost their baby and what should happen, and the other type of care that they deserve, and the respect and the dignity of care that should be given to them. Because remember, it's not only the grief that they have to deal with, it is the ongoing process of having to live with the grief and the loss in the community as well, and continuing to have a life after having lost their baby. So how do we balance that, and how do we make that healthy for parents? And that is why today it makes me such an advocate for ensuring good health outcomes for women, children, and adolescents. So as media, it is up to you to tell my story and to tell the story of all the other parents like myself who have experienced these issues, so that the communities, the societies, and countries we live in can make the necessary investments so that these issues can be avoided. So I'm hoping that today's discussion can help us all in our efforts to highlight the critical issues and to generate better futures for women as well as children. Thank you.
Thank you so much, Nonkululeko. And I'm always of mixed perspective when you speak. I first of all just want to thank you for sharing that story, and again apologize that you had to go through that. These are difficult circumstances and situations, and we can only thank you for using your voice to advocate for these issues. And I think your welcome to us is important because it helps highlight who is behind the 4.8 million and who's behind the 260,000. And I know we tend to speak of numbers, but behind those numbers are actual lives affected that are direct contributors to society as well. So thank you for that. So without further ado, I'm going to hand over to Adelaide Onyango, who is the Acting Director for Health Systems and Services Cluster at WHO Afro. Adelaide will help us understand from a sort of broader perspective, what are some of the trends related to these issues, why they happened, why this mortality and why this morbidity, what would drive change in countries. So what we actually need to see countries do, and sort of where journalists can get the information on these numbers so that they can report on this. Adelaide?
Hi, can you hear me well?
Yes, very well.
Okay, thank you. I'm sitting in a place where the internet connection is very unstable. So if you suddenly see me drop off, it's because of that. Distinguished colleagues and friends from the media, what a powerful constituency you are, and what a wonderful partner in this agenda on women, children's and adolescents' health. It's a privilege to join you this morning and to bring the faces of women, children, and adolescents into this conversation. Why are we concerned about the well-being of women and children and adolescents in this region, in the African region, and how are we doing? By 2050, 2 out of every 5 children born in the world will be African. Already, our continent has the youngest population on Earth, with nearly 1 out of 4 under the age of 20. This is both our greatest opportunity and our greatest responsibility. After all, they are our children. They are children still. Why is it a responsibility? Because 2 of every 3 maternal deaths occur in our region. More than 1 in every 2 under 5 deaths are in our region. The adolescent pregnancy rate in our region is more than twice the global average. And without concerted effort, close to 2 in 3 children in our region may not attain their full developmental potential. These are not different conversations, rather one and the same. It's a conversation about development in our societies. And why is that? Because the health and well-being of women and families affects the health and well-being of their newborns and their children and the older children. Early life experience, including prenatal life, have long-term effects lifelong effects. Healthy, educated, thriving adolescents become productive adults. Healthy aging is influenced by the early years experience and behaviors, and that is why we talk about a life course approach. It's an opportunity because if every African child can survive, thrive, and grow into a healthy, educated, and empowered adult, then the Africa we want will be within reach. But if we fail to protect health and rights, if we risk losing an entire generation's potential. How does this shape the broader development agenda? Health is not separate from development. It is its foundation. Healthy women are more likely to participate in the economy. Healthy children are more likely to succeed in school. Healthy adolescents are more likely to become productive, resilient adults. Investing in health multiplies progress across the sustainable development goals, from education to gender equality, from poverty reduction to peace and stability. Africa has already shown what is possible. Since 2000, maternal mortality has fallen by nearly 40% and under 5 deaths by more than half. These gains prove that progress is achievable despite resource constraints. But we are at risk of losing momentum. We have funding cuts. We are looking at fragile political will. Misinformation threatens, and all that. They threaten to stall or even reverse the gains. 3 priorities stand out in terms of what is needed. First, political leadership. Women's, children's, and adolescents' health is everybody's agenda, but critically, as a national development priority, it has to be noticed by the heads of state. Second, all of government resources directed to transforming our social and health systems to deliver people-centered, resilient, and equitable services. This is what primary health care is about. And third, enabling the agency and resilience of individuals, families, and communities to promote their health and well-being. So, how can media professionals help to tell a compelling story that will catalyze action at scale? I think this is where we would like to have, I think we want to learn from the media. How can we make this a story that you can tell with your professional prowess and help us to get the voices of women, children, and adolescents heard? Back to you, Tilly.
Thank you so much, Adelaide. And I just wanted to flag that I shared a background presentation that Adelaide's team prepared, which we will share as a resource to this so that you actually have the statistics that Adelaide referred to earlier on in the presentation. But thank you so much, Adelaide. And with that, I wonder then if we can start by moving into our first panel. And so our first panel will be, or perhaps since we're doing well on time, let me just pause because we do have about 50 people in the room to ask if people had any questions for Adelaide specifically, just on the burden, any clarification questions, and then we can move into that first panel conversations. Yes, the recording will be shared. So I saw one come in. So perhaps we can move into the first panel conversation. If you do have any questions, oh, Rachel, I went too fast there. Please unmute and go ahead.
Yes, good afternoon, doctor, and thank you so very much for your question. You mentioned so much and which we regard as a problem. So my question will be, what are these challenges that is making us not to get it right when it comes to maternal health and mobility? What are we not doing right? Because we keep having conferences. We have we've been to different forums where we keep getting these numbers. Instead of them reducing, they keep going higher and higher. What are we missing? What are these missing links that as journalists we need to take back to our communities to ensure that it is corrected also and over?
Yeah. I think I would say one of the biggest problems is that we get used to the fact that children die, mothers die in childbirth. And it's not dramatic enough. Because if you look at when you tune into the news, our consumption of news and our consumption of what's important is marked by drama. We have stopped, it's not a dramatic thing. It's a silent scourge. It's been happening for so long that we've kind of gotten used to the fact that it happens. And as Kari said when she was making her introductory remarks, we cannot accept this as an unfortunate something. One death of a woman in childbirth is too many. One child who dies is too many. When Nonkuleko, sorry if I don't pronounce your name correctly, told her story, she was talking about the silence around it. There wasn't, if she had cried out, somebody might have picked that up as, oh, something has happened here, but it was silent. So I think there's a lot of silence around it because we've gotten used to it. And we need to find ways of speaking about these things that can make that silent suffering tangible and palpable, because people need to understand that we have to invest more because funds are going to other things. Funds that are being cut from health programs are going into security.
Mm.
So our priorities are changing, and women's and children's and adolescents' lives, I mean, human life, is becoming less and less an issue. We are more worried about economic growth, deals. I mean, it's highly political. What is important is highly politicized. Thank you.
Mm. Thanks, Adelaide. And that reminds me, internally, we did some social media work on this, and not to speak of the 4.8 million figure. But if you look at just the 260,000 women that die every year, that's about 7 full stadiums. So football fields. If you imagine at the height of the CAN or the European Football League, 7 times a full stadium, everyone in the stadium dies. Imagine the noise that would be made around that, and then compare that, I think, to the silence that Nonkululeko mentioned earlier on. It's that bit that I think is flustering for us. It's how do you make that then what it's supposed to be in terms of the impact that it actually has on a day-to-day basis. Let's take, I think I see another hand up, Aveline, and then we can move on to the panel. Aveline, you're on mute. You have the floor. Still on mute. Devi, do we want to try to, can we unmute her from our end?
She has to approve.
She has to
Yeah.
approve. Okay. Okay, well, Evelyn, once you manage to unmute, please do feel free to jump back in with a question, but I'm going to move us on to the panel because that is the crux of what we want to achieve today, but also one of the questions that Adelaide put, I think, to the group in terms of how do we learn from media about how we sort of strengthen the coverage for these issues. And during our first panel, we're going to hear from 2 journalists. We're going to hear from Kim O-Cham, who's an independent journalist freelancing currently for the Associated Press, Nation Media Group in Kenya, Mano Reporters in Sierra Leone, as well as a number of other outlets. He's also coordinating a number of national and regional media networks in Sierra Leone. And then Tulip Mazumdar, who is an independent journalist as well, broadcaster, moderator, who many of you may know from her time as BBC Global Health reporter. She's also an avid advocate for some of these issues. So I want to welcome you both to the call. And I want to start off with Kimo, if you're here. I can't see you on camera. Kimo, are you online? Okay, well, let me figure out what has happened to him and see if we can bring him back online. But in the meantime, maybe Tulip, you can help us answer the question that's being posed by so many of the partners around the table. And it is, how do you write a story that is sufficiently compelling for it to drive uptake, I think, in the journals that you work on, and to drive change? What is the secret sauce or the secret recipe to make change?
Thank you. Yeah, thank you for inviting me here today. It's really lovely to be here, and it's great to see so many people committed to this issue from around the world, particularly in African countries here online today. So it's lovely to all be together, and I'm glad we are. So yeah, I was, just to give you a bit of background, I was the BBC's global health correspondent for 10 years. I left last summer. And women's health had always been a key part of my reporting. We'd done quite a bit on things like maternal health in particular. We did, I did FGM, obstetric fistula. We looked a lot at that in Uganda. We did do a lot on FGM as well here in the UK and in Kenya. And we did general kind of women well-being and health and violence against women as well with acid attacks. So there was a lot in this area. I was already kind of very keen to get on air. And then the numbers are really difficult, aren't they? Because they're big and you can't quite digest them. And it doesn't, when you hear this, 260,000 a year, 700 a day, you sort of get lost in it. And it's what a few people have talked about, on this call already. It's those individual stories that really, I think, resonate and that bring it home to people. Because in the end, this is someone's mother, someone's sister, and also all of us, no matter where you are in lower middle income countries or somewhere like here in the UK. It's either happened to you if you're a woman, or someone it's happened to, where they've had a difficult, at the very least, a difficult pregnancy, or someone has suffered loss, or somebody has died during pregnancy. It's so common that we do see it, and I think cutting through the news agenda, and getting these stories on has become more difficult, I think, in recent years. I think, all the journalists online will appreciate that everything happening in the Middle East, in Ukraine and Russia and the US is obviously a huge political story. It's really, really hard to cut through. The way I did it and so towards the end of my time as global health correspondent, we did a lot. It was my main story, actually, was about maternal health, and particularly around pregnancy loss. And some of that, frankly, was because I suffered a number of losses in my last few years as global health correspondent, over a period between 2005 and 2019 and 2002. I lost 5 pregnancies, and 2 were later in pregnancy. So I gave birth to 2 tiny boys, River and Ray, in second trimester. And I was shocked to my core at how common this was and what it meant to go through that, and how little we were talking about it. And, we heard before from Nonkuleko about that loneliness and the silence. And that is what, answering the question the lady asked before, why isn't this higher up on the agenda? It's because of the silence. It's because of the silence of women like me initially. It's because of, like you mentioned before, about everybody, it's just become, this is what women go through. It's really sad, but we lose babies and women die during pregnancy. It's been happening since the beginning of time, and it's almost seen as, oh, because it's happened so much, it's okay. Whereas no, because it happened so much, it's not okay. In fact, something needs to be done about it. So, I think the key things for getting the story on for me was, frankly, my personal connection to it. It gave me kind of gravitas on the subject with editors, but also with the women and the families that I was talking to. I was so enraged and compelled to do something it's the only story I did, frankly, for a good couple of years. I didn't do anything else. We did a big documentary on miscarriage care around the world. We looked at kind of solutions and what things, what developments there have been in helping women have healthier pregnancies, and what can be done, that it wasn't this lost cause. So that was a really big thing. It wasn't just really sad headline followed by really sad story. It was, it doesn't have to be this way. Things like when progesterone was made part of the guidance for women who had repeated miscarriages here in the UK, for example, that was something that it was a solution. We looked at VR, again in the UK, looking at VR headsets that women could wear during a DMV, seeing through removing a pregnancy, or removing pregnancy tissue, as they call it, after a loss, that you could kind of wear these headsets that would kind of take you somewhere else for a time. I mean, it was just one of a number of things that they were looking at to try and make something that was so difficult more bearable for women. And I'll end with the last thing that really kind of, I think, touched people, was when we looked at miscarriage care around the world. And I can send through some of the links to the work if that's helpful. The one thing that women, I'm just looking at it now, we spoke to women in Malawi, in Japan, in the Gambia, in the UK, in Pakistan, in the US. And what all of them talked about was this feeling of being alone, ashamed, not having a voice, even during the loss, because even the doctors and nurses, some of them who, were just not, they didn't give the care that the women wanted, for many reasons, but that wasn't there, and everyone talked about that. And what really came across was this need to talk about it, and if it is spoken about and we get those stories on air, then not only do people feel less alone because it happens to so many people, but it also puts it, well, as everyone here knows, it makes, policymakers sit up and listen and watch this stuff and are affected by it, know it's happening, and can therefore start doing something about it. But nothing will happen if we don't hear the stories. Sorry, long answer.
And a very good answer. And I know that Kim was joined us, and he's online, but I did want to do a follow-up with you before turning to him, because I'm hearing a couple of things. And I think one of the driving factors was your personal will and determination, right? So the enragement, the fact that you wanted to see this through because you had personal experience with this. So I think we can say to some of the people on the call that having a champion in-house makes a difference. That's the way I heard it. It sounds like creating those champions comes from a space of empathy and understanding what people are going through. So so having the voices, but also perhaps us having more conversations with journalists so that they understand what this issue is, and then having the gravitas, or and I think that's somewhat related, because the people who've gone through the experience can speak to this in a way that no one can. I think one of the things, as you spoke about your 5 miscarriages, I mean, I was taken aback. I've had 3. All early pregnancy, and this is probably the first time I've said it out loud, but I can't imagine what it would have been to have them later on in the pregnancy. And one of the questions that came up, because we asked people to submit questions ahead of time for this, was, how do you encourage people to speak about things that are stigmatized, difficult, non-touch subjects, that you put you in a space of vulnerability where you kind of think it's abnormal or something that you shouldn't be speaking of? How do you encourage people to speak about that? And then from an ethical perspective, how do you accompany people in speaking about that?
It's the most important question to ask yourself when you're doing these sorts of interviews. So especially with women from countries where it is particularly kind of difficult to speak out, or where women are, you've seen, if you're defined by your fertility, right? If you lose a baby, that you're somehow less, or that it's your fault. And so I mean, certainly what I said, so this was always front and center of my mind. So it was really important how you got consent, and also the kind of follow-up aftercare that you gave people. So when it came to asking people, both here in the UK and every other country we reported from on this, and I was, one of the last stories I did, and again I can send this round, was about the impact of extreme heat on pregnant women, and that was in India. We went to a very rural area in Tamil Nadu in southern India, where we spoke to women there, and at first we went out not knowing whether anybody was going to speak to us about it. And again, that was tricky. Again, journalists on this call will know the BBC was putting up money to tell this story, and I was like, yeah, we might not get any women who'll actually talk about it, but and I'm so glad that they invested the money in it at that time, because when we went, so there was a lot of sort of conversations that were happening before we went. When we went, no cameras, nothing came in. I went and sat down with the women before we started. So we went to their home, we sat with them, we had tea. I explained what we were doing, why we were doing it, and importantly, where and how it was going to be used. So it's not just going to be on TV in England. It's going to be online. It's going to be, on TikTok, on Instagram. You have to assume people, your family or people you haven't told, are going to see this.
Yeah.
And for you to really consider what that means and whether you want to do it. And so the women's well-being and the family's well-being were always at the center. And then often the women would say yes, and then they'd be worried about the husband. And so you know, where relevant and where it felt right, we'd bring the husband in as well and we talk about it. And then, you know, often the husband who hasn't talked about this, I mean, the impact on men is another story altogether, which we also did, by the way. And often they would really open up and start talking about it and be really keen for the partner to talk. But I think that, you know, the key thing was we took our time, we didn't rush it, we got proper informed consent, and also we said if things change for you afterwards, you can withdraw your consent and we won't run it. Which again, like, and this has happened where we've done a piece, it's ready to go, and then someone pulls out, and you're like, oh, but it doesn't matter. It's like, you know, that's their prerogative, and you have to respect it, and you have to say you'll respect it and then follow through. And then the other thing is that we always followed up with people afterwards, if not directly through the organization, we found them through and just made sure that after it went out, that they were okay, and if they had any further questions. So you just sort of try and keep that open for a good period of time, around 6 months we did it for. So yeah, and again, just having, I always, once I became open about my losses, and Kathy, I'm really, you know, I'm sorry to hear of yours as well. It's just a really horrible thing to have to go through. When I opened up about it, others felt able to do it with me as well, and so I think that did help.
Thanks so much for that, Tulip. It's absolutely wonderful to hear. I think part of what we hear for this, but what we hear from maternal newborn child health programs writ large, is in investing and the time that it takes to build relationships, to go down the last mile, to go down to the communities, and to actually speak to the people that need to be spoken to. So that's very refreshing to hear. I want to change tracks and go to Kimo and hear whether he's had a similar experience in reporting. So Kimo, if you can tell us, you know, what has made reporting on these issues successful for you. I see Tangi in the comments right now is saying that, you know, a lot of people, a lot of women want to share their experience and their journeys, but that the uptake for these stories is just not there, and that people don't want to listen and they just aren't interested. What has worked for you? How have you done it?
Thank you. I hope you can hear me.
Perfectly.
Good. Thank you. So I want to start with a story that is not particularly mine. And this is just today I had it. As I speak to you, I am on a tour. I am part of a team of journalists, development experts, and representative from the Ministry of Health, the National Public Health Agency. So we are doing a mapping of health reporters across the country. Now, we have not had a really serious reporting of health in this country, even though we have had my organization since 2019. There are various many factors responsible for this. There is one radio station held a meeting about an hour ago. One of the reporters shared a story about an incident, a maternal death that happened. They call it wasting, and they call it. When he called a public, the Ministry of Health official in the district, he said there is a maternal death case we have heard about, which we are investigating. And immediately they went into work trying to convince him not to report. And in fact, they told him it's not a maternal death, it's to call it waste, you know, blah, blah, blah. Now, this is a reporter who is not experienced in reporting on health. He was confused, he abandoned the story. Okay. There are countless of this kind of experience journalists can share with you. I've gone through so many myself. But for me, what this story tells is one of two major problems we face here in reporting maternal and health in general, the lack of capacity for journalists. So investment is needed first for us as journalists who are reporting on these issues. We don't know, but we face other problems, and this is highlighted in this issue, in this story shared by this access to data. You know, data as simple as how many people died last year for Lassa fever. For Lassa fever, for example, this is not the topic. It's not about Lassa fever, but it's something that very recently happened to me. I needed this data. I contacted the communications people. They referred me to the right person who should give me the data. He didn't respond to me. I sent official email, he didn't respond. Again, these are problems that we have faced all the time in reporting. And we cannot really report if we don't have the cooperation of these public officials, if we don't have data. Data is a very major problem we know across Africa, but especially in countries like Sierra Leone. We keep saying it, and we've been saying it forever. And you don't see any effort being made, to stop this. So we need that collaboration. Hopefully for us, what we are doing now, as I said, we are doing this mapping. We have had a lot from the officials. They've told us what they intend to do not just capacitate us, but we are looking forward to use this as opportunity as well, to create or to remove that barrier that is there, that is helping. So I don't think, I am a man, I don't know, I feel like I don't know whether I am the right person to speak on this. I mean, because I feel like it would have been more appropriate if female journalists speak on this. I mean, there are some, when we are reporting, there are areas that we cannot go because of our gender. Sometimes for, cultural, sociocultural issues, but sometimes it is imposed on us by the people that we are dealing with, say in the health facility. So to go down to your question, which will kind of, give you an idea about what I'm trying to talk about. Regardless of all these challenges we face, what have we done? How have we succeeded in doing the little that we are doing now? I belong to a network, which I called the Kumra Media Network. Kumra is a Creole term for a lactating mother. But as part of this initiative, which is the Qumran Network, we have kind of reinvented that term, if you will. We now make it to mean both the man and the woman of parents that's from pregnancy, to childbirth and up to that 1,000 days. This network is established by an organization called Focus 1000. Focus 1000 has done very great. They work around maternal health and various other health issues. So we comprise of religious leaders, both Muslims and Christians, traditional healers. There is a reason for all these groups getting involved in what we are doing. The mainstream civil society and the media. So I head the media arm of this organization. One way this has helped us is we have been able to access data through them. So we blend journalism and activism, advocacy. So in our advocacy, they do research, for instance, the organization. They collaborate with the Ministry of Health. So in this process, we are involved and we are able to hear or see this data. So it's easily accessible. Sometimes if it is not directly involved in what they are doing and we want data, we go through them. And somehow they find a way how we can get this. So this has helped, but just to a very little extent. I mean, to a large extent, we still are fighting for this. And if we are going to be able to make any bigger impact than what we are doing now, that has to be addressed. A lot of the time, they point at what I started with, the fact that we lack the capacity. And they say when journalists interview officials, for instance, they misinterpret them. And because of this, they don't know. But we know, even though there is some level of truth in this, that is not the bigger problem, the bigger issue. The bigger issue is officials are afraid to come closer to journalists because of the word that we all are afraid to talk about, which is corruption. So there's a lot of corruption in the health sector. We know Africa, we have that problem. And the scenario I mentioned, the experience of the journalist in the radio, when he was called by what we call the DMO, that's the district medical officer. This person is the one in charge of the health sector, of the health ministry in the district. They told them not to report it. And the only reason why they could do that was because they knew it would be investigated and they will find out that somebody has not done their job in there. So in the Ministry of Health, I know we have very limited time to talk. I'll try to rush now. In the Ministry of Health, they have some kind of an unwritten policy wherein officials don't talk to you, or first they will frustrate you. You go to a very remote village, for instance, you are reporting on a very minor but very important incident. maybe say a stock out of malaria medication, for instance, and you want to get, maybe somebody has complained, a service user has complained to you as a journalist, and you want to get the other side of the story, as we say, from the nurse. And she will tell you, call the permanent. This is not even in the district where this happened. They'll tell you, call the permanent secretary to get permission for me to talk to you. So, I mean, the journalist has no option but just to abandon that story. These are very many problems that we are facing, which is making reporting on maternal health impact very difficult.
Thank you for that, Kimo. For one, the comments are very different from what we heard from Tulip, and it brings us towards shifting the balance away from what journalists need to do to what also, as partners to journalists, we need to do to make sure that the landscape enables you to report. And we've heard this tension when we've tried to broker relationships between civil society and the ministries of health as well, in terms of making sure that everyone is seen to be a joint actor in a common battle, as opposed to we're trying to make you look bad because for some reason or not. And so I think this is a good segue to the next panel that will discuss what are some of the partnerships that can be put in place to help facilitate that. And I know AHBN, Nation Media Group, and Internews can share some examples there. But before we move forward to that panel about how we create the enabling environment, one of the comments that I think it was Tangi again that made in the chat is around the lack of resources, right? I think she mentions that she's the only person covering these issues within her media house. There's insufficient funding for freelance journalists to cover these issues. And so there is a tension because you have to manage your day-to-day in terms of how much effort you can put into this. So what are your thoughts about that, or anything that can be done to facilitate from that perspective?
Yeah, I think, I don't know where Tange is from, but I don't think there is any country that Sierra Leone is better than in terms of this predicament that we face. Here in Sierra Leone, almost everything is centered around politics. And, politics is a wider, phenomenon, but we are talking about the politics, like who wins and who doesn't win, that kind of thing. So important stories like health on newspapers are shown on the back pages. On the radio, they are apportioned to the less listened to programs. And there's a reason for this, because these stories don't sell. And because they don't sell, they want to do stories that sell, that bring them funding. So I'll tell you, I did say we are on a talk. We've gone to many radio stations, and almost the concerns are the same. A lot of these media houses have nobody that is dedicated to reporting on health. I know we do have issues about specialized reporting generally in Sierra Leone, but health, I think, is the least prioritized. They don't have it at all. And the few who have, some of them have not done their health program, their weekly health program for the last 6 months. Some will tell you we don't remember the last time, all because they don't have resources to fund these programs. But resource is one of them. Of course, I've spoken about collaboration. Now, when you are reporting, sometimes you need these experts to come to your studio to respond to some of the issues that are brought up in the They don't. I visited yesterday a radio station that is operated by the Ministry of Health itself. It is within the compound of a midwifery school. Now, this station manager is one of us. She runs this station with a small staff, and she started complaining how even within the midwifery school itself, when they want to get them to discuss what they are doing, they don't get them. They are afraid to talk. They say the same thing. They refer them to FITA. You are the one who employed me, and I'm asking you to talk about what you are doing. Share midwifery. You know how the midwifery school is very central to what we are discussing now. And there is a lot of problem around the conduct of midwives in this country. We have what we call the free healthcare, which was introduced in 2010. It targets 3 categories of people. Pregnant women, lactating mothers, and children under 5. We have been reporting as journalists forever that has never worked, but they keep insisting it's working. And part of the reason for this is the conduct of the healthcare workers. So, if you have that kind of situation and you have a radio station and they are giving you the platform, they want you to speak and you cannot speak, that tells you what the rest of us. So, how we can solve this? Sierra Leone, we are very far from there, because the way their interest, not these issues, was the platform for us to discuss this. I think we need more independent media houses that can fund themselves so that we can be free to speak on these issues and spend resources where they are needed.
Okay. Thank you, Kimo. That's fantastic. I do want Tulip to also weigh in on this question, but as she does that, I want you to prep maybe just for final remarks for this panel, because you mentioned that that these issues aren't sellable. And so when Tulip's done, I wanted both of you actually to reflect on in 30 seconds what we can do to make this sellable. Like, how do we change the narrative so that it becomes sellable? But before that, Tulip, do you want to weigh in?
Yes, and maybe this touches on that question as well. I just wanted to offer, and it's different in different contexts, but I hope this will be helpful, some practical advice on getting these stories on without having to spend lots of money. Because I appreciate that obviously I had, the BBC behind me and I don't anymore, and I'm really getting used to kind of what that's like. So I think the personal stories and reflections of people, they are at the core of every bit of journalism, right? And particularly a story like this, which is so emotive and so many people, albeit silently, might identify with. So I just wonder whether you can get, if you know somebody that's got a really powerful story that they're willing to share. One, and I can send this around as well, that we did was about, and it was awful, but you couldn't ignore it because it was just so terrible. And it was about a couple who turned up in A&E having lost, and I'm sorry, I'm going to be quite graphic here, who'd lost their baby, again quite later in pregnancy. They were sent home and she ended up delivering her baby into the toilet. She scooped the remains out and she took it into A&E with her, a baby, and they were told there's no accident and emergency, there's no fridge here to keep it. Please take it home and keep it in your fridge at home. And it was utterly shocking. And that story that I did with them, the headline miscarriage, we had to put our baby's remains in a fridge. That grabbed people. And that was, on so many of the bulletins that day, and it stayed sort of in the top half of the running orders for most of the day. Now, that is a photograph of the couple. I'll send it round. Hang on. That is a photograph of the couple and essentially their first person story. And then I go to the hospital and I ask for a response. Now, I appreciate what we're hearing here from Kimo, and I know others, and I've worked quite a bit in Sierra Leone, reported from there and other countries where officials are often not very willing to give you a response. All you can do is ask. You can ask again and again. And if they don't respond, they don't respond. You write that. You say, we asked the Ministry of Health or the relevant department or the hospital for a response, many times, and they didn't respond. I mean, that says everything you need to know. And you can also use the statistics. You want, of course, as localized statistics as possible. The WHO has some really great breakdown, and they can probably put you in touch with the people they use on the ground to kind of get some more of the kind of regional or more specific stuff. And then the other thing I'd say is just nurturing those relationships with officials and kind of hospitals as well, going for coffee with them, just making yourself known so that as and when things do come up, that kind of getting access is a bit easier. I mean, we do it here in the UK all the time. It's really hard to get into hospitals here. You've got to go through a million different people and get all these permissions and everything. It's fair, it's understandable, you're with members of the public and you're filming in sensitive areas, but there's a lot of hoops to jump through. But kind of having those relationships already so that when a story does happen, you can get in touch with their maternity department. They know you, they know that you're doing this from a place of integrity and honesty, and they will allow you to come and do stuff. That kind of investing your time, which again I know is, you end up doing it for free, but if you can do that, just a coffee every now and again, it can really help when you need them.
Thanks so much, Tulip. And so I'm taking away the personal stories as the hook, and then the nurturing the relationships in terms of getting access. Kimo, your 30-second pitch on how do we make this sellable?
Yeah, I think given our own situation here in Sierra Leone, I hope you can help me. You can hear me
Yes,
now.
yes, I can.
I think the only way we can do here in Sierra Leone, I think I mentioned briefly that at the end of my last statement, that we need more investment from independent, truly independent media interests. Majority of the media houses we have here, they are they are actually registered as independent, but are really not independent because the owners have political interest, and this kind of restrict what we talk about. So investment has to be done for us to get truly independent media entities. Yeah, that's the only way I think we can be able to provide content that are salient.
Thank you so much for that, Kimo. And thank you both to you and Tulip for wonderful insights. This has been just brilliant for me to hear and very encouraging in terms of what we can do moving forward. And I think you've done an excellent job at laying out some of the challenges that we want to address in this next panel on looking at resources and strategies for accurate reporting. I do want to mention that I just dropped in the chat links to a variety of tools and resources, the WHO Global Health Observatory, where one can model some of these indicators, as well as links to the Global Strategy webpage and the EWENI webpage that actually have ready-made scorecards with data, country-specific data on all of these issues, as well as links to what we at the partnership call collaborative advocacy action plan focal point. We have 10 countries in which we work with civil society organizations that can be tapped on for interviews and those personal stories, and to our e-blast, which comes out every month, and for which we insist on having, at least for the past 5 months. You'll see a Voices tab at the top of that where you can get some of the personal stories to inspire your work. But just moving on to the next panel, we're going to speak now on what do we do to create this enabling environment. And we have with us Pamela Sitoni, who's a public editor and the former executive director of the Nation Media Group in Kenya. Aminu Magashigarba, who is the founder and executive director of Africa Health Budget Network, which is a budget advocacy NGO based out of Nigeria that works at the sub-regional level, and Jeanne Bourgault, who is the CEO of Internews. So thank you all for joining us. You'll see how important your contributions are based on what's been raised. But let me start perhaps with Pamela. In terms of what are some of the editorial policies or newsroom practices that can help ensure the WCAH women's, children's, and adolescent health stories are prioritized and covered consistently, right? We've heard some of the issues that have come up from our colleagues. What do you think can be done to create space for this?
Hello, everybody from Nairobi, and thank you, Kadi. And I'd like to start off by thanking all the speakers who've laid the foundation for this conversation. So I think I'll start from a point where, can you guys hear me?
Perfectly, thank you.
Yeah, so I'll start off from the point where it is widely believed that health stories are boring and they don't sell, and therefore they are not prioritized by media houses because media houses are interested in either whether if you're on TV, then you want audiences, and if you're on print, you want circulation, and if you're online, you want footprint to give you enough clicks to either attract advertising or to attract reader revenue. From my own experience, having served as managing editor, I realized that this, of course, was the widely held view. But one of the things that we did constantly was invest in reader surveys. And every time we had a reader survey or an audience survey undertaken by our marketing department, the result would be that they would say they're fed up of the political coverage that is day in, day out. And and health was always one of the top desired news that the people expressed. And so I would say one of the things is to actually listen to your audiences and hear what they want. What is it they want? And unfortunately, it did not always then correlate with the uptake of the content, or because again, circulation was monitored on a daily basis. So that did not quite reflect, but it was their wish to have more health coverage. And so what we did is we then became very deliberate about health coverage. We launched a specific, on a Tuesday, we launched a pullout that was called Healthy Nation. And that pullout was just about health. So a 16-page pullout that covered health stories. But even where you have that kind of dedicated space, we also had a channel on television on health, and we not a channel but a day where we had a specific health program, and we also had online a vertical on health. But even when you have that kind of dedicated health space, it is tempting to focus on lifestyle diseases and things like that. And so it's very important also to have ratios and say, this is how much we are going, even within our health coverage, we are going to dedicate this amount of coverage to child and maternal health, and this amount to adolescent health, and then we'll dedicate so much to other health issues. For example, I sit on the board of an organization called Willow Health Media, and Willow Health Media covers health stories, but even within that coverage, the editorial strategy is to have 70% of the content dedicated to child and maternal health coverage. So in addition to putting aside space or airtime on television, media houses must invest in personnel, and they must also invest in resources to enable this personnel to undertake the stories. Again, at Nation Media House, we were lucky enough to have a partner that believed in what we were trying to do, and therefore agreed to fund the health desk at the Nation Media. When you have dedicated personnel, it means that they will not be distracted to go and cover something else. Or if there's a breaking political story, they'll not be told, forget about what you're trying to pursue with this health story and dash and do that political meeting. It means they are dedicated to their coverage and they'll only focus on that. And also another strategy, of course, is to invest in training. Training because the health journalists need to understand the issues. It's not just, you don't just wake up and you become a health reporter. You have to understand even basic concepts like what is child mortality, what are the causes of child mortality, how can it be prevented, and how can you write the story in a way that you're not just putting out the problem, but you're also writing a story in a way that it offers a solution. How can you write a story from a human interest point of view? How can you write a story in a way that it still resonates with your audiences? So investment in training is also important. And then I think my favorite for me is ensuring that if you have a newsroom, you have a balance, especially at the level of decision making when it comes to the making decisions about content and where that content sits. It's very important to have women represented at the decision making level. And I say this because sometimes it really takes the wearer of the shoe to understand where it pinches most. When I was managing editor of the Daily Nation, I once decided that the biggest story of the day, of course, the biggest story of the day is what the whole editorial team has decided. But when you are the managing editor, you're the main decision maker there. So everybody gives their suggestions, and then we say, okay, from all this, I think we shall splash this one. And I splashed a story about university students who were, because of desperation, they were selling their eggs for a pittance. And they were not just selling their eggs, once, but they were doing it repeatedly, and they were being exploited by the health practitioners who were then selling those eggs to women who desired to have children. And that story did not look like your usual splash story. And I have always believed that it takes a woman to put out that kind of story on page one and to defend it. And I was proud to note that it actually gave us increased circulation. The other thing, again, in addition to the reader surveys, when we started our health coverage, after 1 year, our partners who are funding the health desk did their own background check, and they realized that whenever we carried a story about women and children, the uptake was higher than the other health stories. And based on that, they then came back for a discussion again with us to have a desk that was dedicated to gender issues, because there's a very strong link between women's rights, women's empowerment, and the survival of women and children. There's a strong link between education of women and survival of children. So I think with all this concerted effort, then I would say we managed to put health on Kenya's agenda and health coverage on Kenya's agenda. And the encouraging thing was that our readers actually took the trouble to write in, to call in, and to celebrate us for what we were doing. So I think for me, my takeaway is it has to be very deliberate, it has to be well resourced, and you have to have the right people in the right positions. Thank you.
Thanks so much for that, Pamela, and congratulations on what you've been able to achieve in Kenya. And I do want to follow up with one question, because it seems like so much of what was achieved was by having the right people in the right place. And I don't want you to answer this now, because I want us to go through to Jeanne and then to Aminu. But it sounds like if you don't have the right people in the right place, then there's still a level, an amount of work to do to convince them to get there. So when we come back from the other panelists, I want to hear from you about what shifts leadership's perception, right? And it sounds like reader surveys might, anything that speaks to the numbers might, but if you hadn't been you, what would have made that situation successful? I want to leave you with a couple of minutes to think about that while I jump over to Jeanne and ask her, building on your comments right now, and based on the work of Internews with local media partners, what are some of the obstacles that stand in the way of responsible reporting for women's, children's, and adolescent health, excuse me, and how might we apply some of the learnings from Internews to scale improvements in coverage writ large?
Yeah, sure. Thank you, Katie. And so happy to be here for sure. And I actually want to build a little bit on Pamela's comments and Kima's as well. There's a massive market failure in the news industry. I mean, the gender gap of reporters up through leadership means that communities everywhere in the world are not getting the stories that they actually desire. And I think there's just that gender gap. The Gates Foundation did a research project that we sort of try to roll out, sort of saying, if you actually made sure that 50% of content was reflecting women's voices, women's expertise, women's challenges, your audience would grow. Like, I mean, the gap is just so huge. And exactly, Katie, to your point, getting the right people in the right seat, Pamela being managing editor made a fundamental difference. So up and down the news ecosystem, the chain, you have to have representation, and not just women, men, but across the board to reflect the reality of the community the media is serving will be a fundamental transformational change. And so I would sort of say that market failure is one of the biggest things out there to cover the issues that are most important to the full community, right? At Internews, just to stress to everyone here who may not know, is we are not a news organization, despite that name of ours. We're really about building the capacity of news organizations to fulfill their promise, their public, their contribution to the public good when it comes to tackling some of the most critical issues facing our world today. And so we do it as an organization from sort of a capacity building perspective, getting to Kimo's comments about that's one of the big challenges. Something as technical as covering health issues or the environment is tough for any journalist, and certainly for any newsroom if that's not what you've studied. I'll just sort of say we look at these issues and sort of the capacity building of journalists everywhere in the world, from the US, across Africa, across Asia. These are common issues that you really, to get the most impactful types of stories, we have 4 layers that you need to, and we've already touched on them, but I'll just repeat them here for a really impactful story. And this is what journalists are trying to grapple with every day, is sort of getting the facts right and placing them in context is the first one. You've got to have the details. They've got to be cross-checked. Every claim has to have a reliable source. You have to have those government data sets. You have to have those peer-reviewed studies. You have to have on-the-ground reporting to back up the data. And so that the research shows that if you have data and lived experience woven together, stories don't just inform, they can influence policy and public opinion. So the first part is getting the data. And so partners can help ensure that happens. And we've talked about that a little bit. Second, the other piece that we've talked about already so importantly is that numbers alone don't move hearts, right? Human stories give the data a pulse. And so you really have to find those voices. And we again talked about this, and I just want to re-stress this. The mothers navigating these under-resourced clinics, the adolescents from dealing with really challenging issues in reproductive health. We know that well-crafted narratives sort of deepen empathy and memory for why these issues are important, far more than the statistics. So you need your data, you need your stories. And to make them really powerful, you are also holding systems to account. I mean, a story will talk about where policies fail. They will spotlight who is responsible. They will trace how decisions ripple through a community. So accountability doesn't mean blame, but it does bring clarity, right? And so really mapping the decision-making chains and bringing those in power into the conversations, not as a final quote, but as part of the dialogue, is just critical for that accountability piece to powerful, impactful storytelling. And finally, and this is one that is a little less obvious, is that stories really break through when they are actually two-way conversations. The journalists aren't just transmitters, they are conveners, right? Good reporting listens as much as it tells, and it reflects community concerns back to authorities and policy responses back to communities, creating a feedback loop that is just really hard to ignore over the long term. So that's like it's a big, giant capacity building challenge. And you can see different places where we need to collaborate to fill that. But to get to scale, I think of scale as like journalist by journalist, outlet by outlet, market by market, and addressing that very, very massive market failure when it comes to just the news media itself reflecting the reality of the communities they're serving. Scale also, I think, builds by convenings like this, like where we can share best practices, where we can learn from each other, where we can practice to what we're experimenting with. And I also think the scale builds globally through networks of journalists. We've heard a couple of references to those people that are trying the same things across borders, sort of, again, sharing that experience. And so joining networks, creating networks of, specialized health reporting just can make a really huge difference in the world. Stop there.
Well, thank you so much for that, Jen. And I think you bring up an interesting tension. So we've heard from everyone on the call today the need to focus on data and then the need to focus on personal stories. But I think what you bring to the table are two different elements. One around the accountabilities, right? The pointing to where something should have been done that's not been done. And that goes in direct tension to, I think, the point that Kimmo was making earlier, because that then because we're holding certain people to account, we require sort of building a relationship or a narrative that is us against a major problem rather than me pointing the finger to you. So perhaps in your next intervention, it'd be good to reflect on how do you tote the line, right? Between building the relationship and making sure that people speak to you, but then really being true to that accountability that needs to happen. I think the other thing that was that you raised that we haven't heard before is this sort of cyclical or this conversation that we're meant to be having, so that we're not only seen to speak for one party, but that we're brokering a conversation between the two. And I thought that was excellent. I think to your last point, it's a good transition to our next speaker, who's Aminu Magashi-Garba, who leads the Africa Health Budget Network, because the work that they've done in Nigeria actually is linked to working with journalist networks to try to see how to drive up reporting. So Aminu, if I can just turn to you, do you want to share the experience that you've had in Nigeria to stimulate coverage of these issues, working with the various journalist networks there?
Okay, thank you. Hope you can hear me well.
Yes,
My
perfectly.
network not too strong. Okay, so thank you, Paddy, and I'll be just switching so that I can get a stronger connection and I can return the camera. So
Super.
I think in trying to understand the role of civil society and a budget network like the AHBN in equipping journalists with evidence and context needed to report on women, children, and adolescent health. Just to buttress that point, is to say that we just returned to office with the HBN team this morning, where I provided about 2.5 hours talk show with a media organization. Just today, we returned from that meeting. I think to me that's illustrated actually this question. It's a practical experience and demonstration of a budget organization like HPN, engaging with a media organization in Nigeria, in Abuja, where I had an interaction this morning with over 25 to 30 team of that media organization. And what was the business of that conversation? Is what we are discussing now. How do CSOs engaging in project and evidence, providing correct and accurate information to the media organization and health journalists in order to help them amplify the messages. So in summary, in the 2-hour meeting we had this morning, we look at the recent health financing report in Nigeria, and also the recent National Health Financing Dialogue, which was connected with the health financing report. And in my discussion with the media, I brought the evidence that they can help them to engage. For example, the health financing report had shown consistently in Nigeria over the last 10 years, the health financing landscape, about 70% of the expenditure is out of pocket, and the remaining 30% brought an interesting findings, whereby the international donor funding is even around 10% of the remaining 30, while the 20% is from the government expenditure and the annual budget. This is a very strong evidence that can support the media to engage in advocacy. It also showed in the report that the innovative financing in Nigeria was not sometimes connecting with the reality of a positive health outcome for women, children, and adolescents. For example, we discussed this morning that the family planning financing in Nigeria is fragmented, with so many agencies procuring the same, family planning commodity. The Nigeria Primary Healthcare Development Agency making procurement, the presidential initiative for healthcare value chain making a procurement, the UNFPA with the Federal Ministry of Health also collaborating, making a procurement, and the National Insurance Authority also through benefit package making a procurement. This is an evidence that we brought out and the media can use to better do their own reporting, using the evidence to engage meaningfully the coordinating minister, the president of Nigeria, and so many other critical stakeholders. And we have been seeing over the last 10 years that we have been engaging with the media. So this is just one example. Not only we do Kadi, we will also organize in our office regular, conversation with the media. We provide the information by writing a press statement to share with them so that they have the information correctly to engage them to, engage the stakeholders. We also develop scorecards that shows, flow of budget information from allocation to disbursement to transparency, accountability, and coordination, and bringing out the gaps in implementation of the women, children, adolescent health. And this is helping the media to really, organize their own reporting and also engage government meaningfully. To my session, I'll give an example of some of the success, we are seeing in this, collaboration. One of them is part of the recommendation we are making in Nigeria through the AHBN was a vigorous recommendation for the Nigerian government to strengthen governance, in the affairs of the government that will promote positive health outcome, reducing maternal mortality and under-5 mortality. And the media are writing stories from that information. And today we are seeing that the government is responding in timely disbursement of the basic healthcare provision fund throughout the country, 36 states plus FCT. And we are also informing the media that every state is collecting money and you need to track the money, you need to report it, and you need to ensure that the governors are held to account to deliver for ordinary Nigerians. These are some of the success stories we are seeing, and we are grateful to the partnership and also the CAP agenda in whatever we are doing. So I can pause there in case there's any follow-up question I need to respond. I'll be on standby. Thank you very much and over.
Thanks so much, Aminu. And it's good to see a sort of positive example of where this has worked out in terms of capacitating the journalists and the media writ large. I think part of what you mentioned that's interesting, many people have talked about the need for data, and it sounds like you're talking about how much data exists about different inputs and helping the media make sense out of all of that. So creating a set of journalist-friendly or even just a base storyline that they can use, facilitating some of that digestion. So I think you help resolve issues of access, but you also help resolve issues of storylining, if one could call it that. And that seems to work out quite well. So we're reaching the end of the panel. So I wanted to go back and ask all three of you if you could share 30-second remarks on what is the one takeaway, right? What is the one thing that would drive, that would make a difference from you? You've all shared a range of different recommendations in terms of things that different partners from different constituencies can do. But if you had to prioritize one, what would it be? And I realize, Pamela and Jan, that I'd asked you follow-up questions, one around, how do you influence leadership? And then the other one around how do you build that tension, or how do you navigate, the tension between relationship building and accountability. So perhaps if you can weave that into it, what is the one thing you want us to take away from today?
Sorry, I lost a moment.
Sorry. So Pamela, I'm asking, what is the one thing that you would want us to prioritize if we were to make a difference? You gave us a number of different entry points and recommendations. If we could only do one thing, what would you prioritize?
I think I would prioritize partnerships because I've seen that work very well at Nation. So partnerships in terms of resources supporting the journalism, you heard from Tulip how much time and effort it takes to just put together a really good health story. Partnerships in terms of the providing the research findings and data and breaking down concepts to journalists, and also partnerships in terms of linking journalists to communities. So I think that's important for me.
Thank you so much for that, Pamela. Jeanne, last word?
I'm going to say just one quick thing on the accountability piece. Remember that sometimes these are focusing on solutions, so it's not always a negative thing. So a solutions approach really makes a big difference to building that trust. When it comes, I'm going to shift the conversation when it comes to one of the biggest levers for potential change moving forward. It's that coupling of hands-on mentoring and relationships with sources with one of the newest things hitting the news media with the addition of AI, right? That AI actually can, when it's used ethically and smartly, really make a huge difference on telling these stories, from analyzing data sets to flagging emerging health trends to sifting through research. It just makes it faster and easier. And so that beautiful mix of very strong mentorship and people connections with ethical use of the tools that are emerging can really, I think, make a transformational change to how we do health reporting around the world.
Brilliant. Thank you so much, Jeanne. Aminu, last word from you?
Okay, so I think one of the, to me, innovation we are bringing, which I will also recommend, is to strengthen the collaboration and the partnership between the civil society organizations and the media. And one of those, collaboration is to be going together. So, for example, if there's going to be an outing in Nigeria, let's say engaging National Assembly for annual budget public hearing, or there's going to be a spot supervision to primary healthcare facility, or we're going to visit a particular agency or a political actor, the media and CSO should go together and now engage meaningfully. The CSOs bring in the evidence and the advocacy, while the media picking the evidence right there during the meeting and amplifying through media channel. Through that, I think concerted effort, we can begin to see meaningful results and also a paradigm shift from the previous approach. Thank you very much.
Thank you so much, Aminu, and thank you for to all of the speakers. This has been, I think, enlightening for me, and just a great amount of very strong information. We've heard recurring messages from all the speakers around the need for data for journalists and reporters to have access to data, to build in personal stories into the way that they work, to build in accountability into the work that they do, and just taking on Jeanne's last point about building in some success factors, some of the positive stories, and not necessarily looking at accountability as a negative thing, recognizing that some of that requires very strong relationship building with the official public offices, but also across a range of different partners, and also relationship building with the people whose stories we are telling, and taking the adequate measures required to ensure an ethical and responsible approach to reporting on people's stories. We're also hearing that the media needs to tell a sort of a two-way story around some of these issues, making sure that we're brokering dialogue towards reaching these results, and that some of what needs to happen to get us there is constant capacity building, something that I think, are keen to do moving forward, training, having regular conversations and convenings on these thoughts. Jeanne left us maybe with one of the last points that we weren't able to raise on this, was how do we leverage AI to facilitate some of the work that we're doing, particularly as resources are dwindling. And so I'm happy for us to host a range of conversations like this one on topics, and you'll indulge us, we'll send you a survey just so we can get your views on what are some of those specific conversation points that you want to have, so we can gather the right expertise to get us there. And I think the final word that we heard from our partners is around partnerships and innovation, right? So how are we making sure that we're building partnerships, one, supporting the media, two, building partnerships between civil society and the media to really help fill in all of these little gaps. So with that, I really want to express profuse thanks, one for the speakers, but also for the extremely active participants, as we saw through the chat, and looking forward to making this perhaps a recurring conversation. Thank you all so much and have a lovely day.